All right, you
Distemper.
guys, we are live with Dr. Alex Shelley at Bourbon City Animal Hospital in Bardstown. And I appreciate him taking some time from his extraordinarily busy veterinary schedule. And I know you're in surgeries all day to talk to us about canine distemper. We had the unfortunate report of a confirmed case at Louisville Metro Animal Services this morning, which is always a nightmare for shelter workers because of the cleaning that's required and the separation and shutting down the shelter to intakes and pickups until the situation can be remediated. And, you know, a lot of people panic. And what we want to do is avoid panic and provide information so that people understand what canine distemper is, how frequently it occurs in the population, what animals it affects, what happens if you have a dog that's been exposed to it, whether you've vaccinated. I want to cover as much as I can in a short period of time with you, Dr. Shelley. So
Sure.
just talk
Yeah.
to us.
Well, hopefully I can help. Distemper is mainly seen as a respiratory virus. We see it, it can have other forms, neurologic symptoms. A lot of times it can also be shown as gut symptoms through the GI tract and even the urine. So there's lots of ways that it can present itself. In fact, it's a lot of times it's hard to recognize just based on certain clinical symptoms just because it can have so many variables to it. The one we see the most is the respiratory form. Typically, the respiratory form is more common in younger dogs, like puppies.
Puppies. Yep.
You're seeing it in younger dogs. It is contagious in the environment for a while. Um, it's
So
spread.
sneezing, coughing, bodily fluids, transmission like that.
Right. Mostly through sneezing and coughing, through aerosolization of the virus. That's
Right.
typically what is the most, and those are the hardest to contain just because of the amount of fomites that can be, meaning things that can transfer that virus. It gets on your clothes, gets on your shoes. An aerosolized virus is difficult to contain sometimes.
Yep.
We saw it very much so back when the canine influenza outbreak
Yes.
occurred and how
Yes.
contagious that was. It was super contagious. Typically, distemper, I wouldn't say it is, I'm not trying to make light of it. It's not typically as contagious as something like the flu would be in a contained situation, but it is still very contagious, and it's a very necessary threat that needs to be addressed for sure, because
So
this can spread pretty quick.
yep. So that's why it's a nightmare in a kennel environment like a shelter or, you
Right.
know, like a boarding facility, any place that has multiple dogs that don't have containment separated from each other, that don't have the sneeze guards between the kennels, where they're in possible play groups, getting exercise outside. These are all the things that fit the description of what a shelter is.
Well,
So people are
yeah, and
concerned people are concerned about the fact that they have had fosters come out of the shelter or that they are bringing dogs in from the outside to a contaminated environment. I just want you to talk a little bit about what people need to be looking for if they have dogs that have been at the shelter or they've been fostered or they've been picked up or dropped off. What do we look for in a dog to determine if it's showing signs of distemper?
it's a good question. The first thing that I know a lot of people need to know and understand is if your dog has been vaccinated for distemper virus, if you're coming home, if you're working there, or you've been exposed and you're concerned about your adult dog that has had multiple vaccines, the chances of that dog having issues from this are very slim. Okay, that's not going to usually be the issue here. It's the dogs that are coming from the shelter that are um, immunosuppressed dogs, never had a vaccine, they're young
Right,
puppies just
right.
being seen. So certain groups or characteristics of shelter dogs are going to be more high risk than others. And the main thing to start watching for is the first symptom is your dog just doesn't feel good. They'll run a fever, and then typically they'll start from that having respiratory symptoms, sneezing, coughing, sometimes nasal discharge. They can have,
Yep.
as the disease progresses, they can have more and more eye discharge, ocular involvement. They just look really sick, like a respiratory sick dog. So, yeah, that's the kind of things to watch for. Any symptom, even vomiting, diarrhea, typically once, especially older dogs with supportive care, can make it through this situation, but they do have to recognizing that early is kind of the key so that you can support them through it as much as you can.
The big thing is that there is no actual cure for distemper. There are no antiviral drugs for distemper. There, supportive care, which means IV fluids and other types of things that will help
Right.
them to feel better, but not cure the disease.
Correct.
That's a huge problem. And what we also are concerned about is it transmissible to humans? Is it zoonotic? Is it transmissible to felines? Because I know that distemper comes from the wildlife population. So if your dog, or this particular dog, patient 0 today in this case, was exposed to a wildlife like a fox, a raccoon, whatever, with distemper, that's a potential transmission.
Yes. And typically, this is not zoonotic to people. It is not something that we have to worry about disease transmission to humans. Cats have a lot of variable other respiratory viruses that they deal with, but this specifically, it does not cross species.
That's a relief. So one of the most important things we talked about is what's called the DAPP or DHAPP vaccination schedule.
Mm-hmm.
And that comes with puppies. That is the most important thing to do for your puppies, is get them vaccinated on a schedule, the certain number of weeks apart, because if you give them one shot and you don't follow up with the boosters, the first one was a waste of a vaccination. Older dogs who had vaccinations the same way. They need to get their shot, then they need to get their boosters. So talk about the importance of vaccinating against these dogs. And also a question just popped up on the live. Can we carry it on our clothes or shoes and bring home to our pets if we were in the shelter? What are the things we should be doing, if anything, if we have been in LMAS recently?
So that's a great question. So first, addressing the question about transmission on the clothing, fomite transmission, it's definitely possible. It's definitely something that if you have a coughing contagious dog and it gets on your clothing, you can take that home. The best recommendation for that is to change your clothes before you go in, somehow disinfect yourself, get in a shower, whatever. Just wash those clothes separately. Typically heat and washing of the clothes should take care of that issue of the virus. It shouldn't after that be contagious on the clothing, but yes, it can. So especially in short periods, like if you leave the shelter and go straight home, that virus can stay active and live on the fomite for a little bit of time, for sure.
What about shoes? Is bleach or walk-in pan with bleach a good solution for that? Okay.
It is, but remember also this is an aerosolized virus. So it's not just, like certain things like parvovirus, they're more touching, it's not aerosolized. So that's more when you get it on your feet and stuff. But all those practices are good practices, and that's all you can really do. Foot baths, change your clothes, use protective garments while you're dealing with any potentially sick patient, and then make sure that those are exposed of properly, and that won't expose your pets at home.
Well, for me, example, I have the same jacket, the same snowsuit, and the same snow boots that I have worn for 2 weeks, and picking up multiple dogs on the streets, delivering them to Metro Animal Services, handling them closely, having them in my car. So there's really nothing I can do about that at this point, but I'm assuming the fomites die off after a pretty short period of time.
They do after a certain period of time. The virus is only, and I actually have, it's not something I can remember off the top of my head, but it stays active in the environment. I know they can release the virus through coughing for up to 30 days, 30 to 60 days, even longer. So, the dogs that are contagious, they need to be quarantined as soon as possible. That's the key. Isolation of any potentially exposed patients and just making that locked off to any new exposure really is the key at this point, and trying to control it.
This is why we tell people who take in dogs, Dr. Shelley, if you get a foster dog from Louisville Metro Animal Services, Kentucky Humane Society, bring a new rescue in, adopt a new dog, that quarantine period is something that most people don't pay any attention to. And I remember very clearly when I got my dogs one after the other, 20 years ago, they advised me at Kentucky Humane Society to do a quarantine period if the dog had not already been clearly, past that period at the shelter, even just coming in from the shelter as 6-week-old puppies. I quarantined them away from my other dogs, and most people kindly trying to help just bring in a dog, throw it into the mix and say, good luck, everybody. It not only will prevent disease transmission to isolate the dogs, it can also prevent fighting. It can also prevent the return of a dog to the shelter because it doesn't get along, because it hasn't had a chance to get used to a dog.
Yes, and the gradual, there's so many advantages to what you're saying, especially getting the dog used to the environment which it's going to live in without other dogs for a short period of time before introducing themselves is a smart thing to do, just behaviorally and overall in general. But yes, for any disease transmission, especially more common respiratory, I mean, the fact of the matter is that we see more kennel cough and more minor respiratory diseases than we typically do the more severe ones, like we're experiencing what you're seeing now. So even those diseases, it's very important to try to separate, because they're very common in any shelter situation. It's impossible, no matter how good or how much work that they do to try to prevent it, it's nearly impossible to prevent that from happening.
Absolutely. And so that's why it's really important for people not to panic, not to, place blame, not to try to create drama out of a story. It's facts, information is power, forewarned is forearmed, which is why I wanted to have you talk about it today. And I very much appreciate your time.
You're welcome.
And thank you to Jessica for being your technical advisor.
Yeah,
Bye, Jessica.
she's always with me. Yes, for sure.
So just as a quick aside, Dr. Alex Shelley and his wife, Jessica, have Bourbon City Animal Hospital in Bardstown. They are a full-scale treatment and surgical center. They are phenomenal. I send people to them all the time because they do the impossible, and they do it for a lot less than you can get it done in Louisville, frankly. But they still are absolutely accessible and available. It's a short drive from here to Bardstown. I think it took me 45 minutes tops in traffic to get there from Louisville. So I trust Dr. Shelley. I trust his expertise and his input. And I really appreciate you just talking about this today, because everybody the explosion just occurs on social media and everybody starts to panic, when in fact, one confirmed case does not indicate an outbreak. And we hope that it does not, proceed. We hope that it is contained, it has been caught, it is being remediated. So thank you so much, Dr. Alex Shelley, for the information.
You're welcome. I'm glad to help. Thanks, Tara.
Bourbon City Animal Hospital, you guys, best in Bardstown.
Thank you.
Talk to you soon. Thank you.
Right. Bye-bye.
Beautiful job.